Thank you, Dr. Muller. And let me start by congratulating Dr. Joe Costabile for his efforts and contributions to the Medical Society during this past year. One thing you know about Dr. Costabile is he walks the walk. I think he embodies, for me, a true believer in the work that we do for medicine, and he contributes selflessly in both his time and his money to advance our mission. And so I want to thank him for his insights and his support over this past year for me personally and for the society. And as we traditionally do and turn the page at this meeting, I'm looking very much forward to working side by side with Dr. Chris Gribbin. We've worked closely before on several projects, including our advocacy team in building the contributions to that program, which he's done a stellar job and brought his leadership to that, as well as kind of transactional issues like our building and real estate issues that we've been dealing with at the board, and his expertise and understanding of those issues has really helped. So I find him to be tremendously prepared and creative in his thinking about moving our issues forward, and I'm confident and very excited about the year ahead. So as you all know, the rapid consolidation that we're experiencing in physician practices and hospital systems in this state, it's not just here, it's all around the country. The recent mergers of large hospital systems, along with the subsequent acquisition of physician practices, continues to create larger and larger physician organizations in our state. I see these large groups as membership opportunities for us, and I know we've had some success on the private, I'm going to call them hospital agnostic groups of physicians. We've done quite well in engaging with them and bringing them into membership. And we're going to continue to work to bring in the hospital-owned and hospital-based employed physicians into our membership. It's imperative that we focus on these because that is the shift that we're seeing in the physician environment. Today's conference, immediately preceding this meeting, hopefully you were there for it, was designed to bring you relevant topical information on cutting-edge issues like narrow networks, tiered networks, alternatives to maintenance of certification, and addressing the increasing levels of burnout among physicians. I'd like you as delegates to do one thing for me. If you take one thing away from this meeting, I'd like you to go back to your practices, to your hospitals, and talk about the relevant issues that were presented today at this meeting, and why it's so important when you encounter those your colleagues that say, who might ask you, what does MSNJ do for me? Tell them about this meeting, tell them about our issues. I believe there's no question that MSNJ is all about building leadership and stewardship in the profession. I want to make just one small note on the Physicians Foundation presentation this morning. I don't know if it's, and I read a lot of health policy, Milbank Quarterly, Health Affairs, and look at the research that's being done and funded by foundations in this country. You will find very few foundations. RWJ has gotten out of the business. They're focusing on nursing profession mainly, and other funders are no longer funding core research, empirical research on physician practice. And the Physicians Foundation is one of the only organizations that I'm aware of that's looking at funding empirical research on things like how physicians spend their time, maybe the most expensive commodity in healthcare. And when some of the research that we published that Tim Norbeck referenced, $15.5 billion a year in non-harmonized quality measurement programs by physicians, funded by physicians and their office staffs, is unacceptable. That amount of money and that amount of time is time taken directly away from time you could spend with your patients. They're also studying meaningful information on the impact of what quality physician leadership means in healthcare organizations. Where physicians are true partners in systems, what does the cost, quality, and outcomes of healthcare look like in those systems compared to systems that say they have physician leadership, but don't allow physicians to have input on capital contributions, staffing ratios, and the real important things that happen in healthcare organizations. So you're going to see more and more research on the study of physician practice coming out of the Physician Foundation very shortly, and I'm really proud of that work. So whether you're a delegate, or a board member, staff, or an invited guest, I'm going to thank you right now for your attendance today and your commitment and your leadership in organized medicine. The action in Washington, D.C. and the lame duck session of the legislature coming this fall that Kim Guadagno spoke about earlier is going to require our attention and quite possibly our action. So I'm going to ask all of you to please read e-news, please keep in touch with us, please watch for calls to action, and please be prepared to engage with us on behalf of your patients and the profession. Thank you very much.
I see people's eyes starting to glaze over a little bit. No snoring. So I'm going to start with a joke. This teacher had a group of preschoolers in her class, and she was insisting that they use big person words, that, none of this baby talk anymore. So she she looked at these three little boys and she said, "So tell me, what did you do last weekend?" And the first little boy said, he said, "I went over to visit my Nana." And she said, No, use your big person words. You went to see your grandmother." And she looked at the next little boy and she said, "And what did you do this weekend?" And he said, "I rode on a choo-choo." And she said, No. You need to use your big person words. You rode on a train. And she looked at the next little boy and she said, "And what did you do this past weekend?" And he looked at her and he said, "Well, I read a book." And she said, "Well, that's wonderful." She said, "What was the name of the book?" The kid thought for a minute. And very proudly he said, "Winnie the Bowel Movement." So, on that note, Madam Speaker, honored guests, delegates, my dear colleagues, I want to start with some well-deserved thank yous. So just bear with me, please indulge me. First, I want to thank the Executive Committee for their hard work and their dedication to the Society. Thank you to the Board of Trustees for their commitment and their efforts. Thanks for coming to those Thursday night meetings. Thank you to the county execs, Andrea, Kathy, Irene, Mary, Nancy, and Jeanette. Please stand. Please give everybody a give them. Thank you for your support and working with MSNJ as we continue to transition and adapt to a changing environment in organized medicine. I want to thank my good friend Larry. He is incredible. He does an extraordinary job as our CEO. And his reputation, as was pointed out this morning, is nationwide, and it's legendary. Larry and I have become good friends over the year, actually even before that. We are fortunate to have him as our society's CEO. I want to thank Michelle Asen. Where is she? Michelle, stand up, please. I want to thank Michelle for all her hard work as our COO, primary lobbyist, and advocate in Trenton. She does a tremendous job. Melinda, stand up. Melinda is our in-house counsel and our legal wizard. She does an incredible amount of work, and we are grateful to her. I want to thank somebody who's not here, Joe Reitman. He's been helpful, a mentor, and a good friend. Now, there's a group of people who pretty much work behind the scenes. They do a phenomenal job. They do the work of a staff twice their size. We owe them a tremendous amount of gratitude. The staff of MSNJ is the unsung hero of the Medical Society. Anybody that's on staff, please stand up. do an incredible amount of work, and my personal feeling is they don't always get enough credit for it, so thank you very much. Without you guys, we'd be sort of floating in the water. I want to thank all of you, our dedicated delegates, and our members for your loyal support and efforts to maintain and grow the Medical Society of New Jersey and the medical profession. It is you that contribute to the improvement of the medical profession and taking better care of our patients. Doctors are leaders, and you are the leaders of the leaders. That gets confusing. Now, this is the most important part. There's one person. Just bear with me. I didn't think this would be this difficult. There's one person that I haven't thanked yet, my wife Yolanda. Please stand. She's had to put up with me more than any sane person could or would or should have to. She's always been supportive, critical when necessary, and providing means of reflecting. Many times she's talked me off the ledge when my Italian temper was about to get the best of me. She's accepted the cavalcade of meetings and conferences without complaints. She's always provided me with good advice, and I am lucky and grateful. Thank you. This past year, having traveled to other medical societies and other organizations, I can assure you the issues that we worry about here in this house, membership, finances, legislative burdens, they're ubiquitous. Everybody is suffering the same problems. And it's interesting to hear how other organizations deal with them. And I've tried to bring some of that back to our house so that we can deal with the issues. Part of my agenda this past year was to try to help out our military and our vets. And at this point, I'd like to give a shout out to a hospital that has taken a very active and aggressive approach to caring both for our veterans and our active military personnel with some terrific medical programs. When I was deployed, we had a saying that we took care of those who took care of you. Cooper Hospital is doing that with our military, and I'm very grateful to them as a veteran, and I always feel weird saying that, but as a veteran, I'm grateful to them for taking care of our vets. So the rest of my talk, I just want to throw out a few thoughts that have occurred to me over the year that we might consider. The first one is that a single-payer system that many people tout it'll make our lives easier, I don't think would be such a great idea. I heard in one instance that a place that had a single-payer system was not paying for certain screening tests. So when you have a single-payer system, if the single payer is not paying for it, it's either coming out of your pocket or you're taking your chances. Don't clap on that one. As hospital systems become more corporate in nature, medical students, residents, and yes, attendings need to maintain their identity as physicians, as professionals, and not be swallowed up by the corporate name. Patients come to see you, the doctor, not the corporation. A lot of the frustration in medicine is due to other influences that have nothing to do with patient care. Insurance companies, legislation, non-clinical personnel, administrators, they make decisions that affect what you do and how you do it to take care of your patients. And many times it has nothing to do with the quality of care. We need to continue to fight that. Many times physicians bear the responsibility to care for patients, but administrators take the credit for it. The high cost of medical care is always blamed on the physicians. Yet usually it's not our fault, but we're the low-hanging fruit, and consequently we get picked on. Intermediary organizations employed by insurance companies that are inserted into the system increase costs and siphon away money from where it's supposed to go, patient care, as well as many of the cottage industries that feed off the healthcare dollars that have little, if anything, to do with quality of care. It's mind-boggling that hedge fund managers will purchase a pharmaceutical company that perhaps makes a specific medication, like an oncologic medication, and make indecent profits as an investment at the risk of patient care because that medication is too expensive and their insurance won't cover it. It is my view that it is not only wrong, it is unethical. These are just a few of the parting thoughts and issues that will continue because These are just some of the parting thoughts and issues that will continue because of this. Organizations like MSNJ and the AMA will remain important and relevant to the profession of medicine because we are fighting for this every day. I wish Chris Gribbin very much success this year. Chris, I'm always available to help you in any way that I can.
That's a good thing.
MSNJ is important to our profession, and we all need to work towards its success as well as ours. Much like my military career, I've been privileged and honored to be your president. Thank you again for allowing me to be the face and the voice of medicine in New Jersey. I hope I haven't embarrassed anybody. I hope I've served you well, and I am indebted to you for the opportunity. Thank you.
I am honored to be presenting this medallion, which all presidents wear with honor and pride. And another one from the Medical Society of New Jersey, which reads, presents this testimonial of sincere appreciation to Dr. Christopher Gribbin in recognition of services to the state of New Jersey and to the medical profession, 2017 and 18.
Thank you.
I'd like you to be seated, Dr. Gribbin, right here. Madam Speaker, officers at the dais, distinguished guests, and colleagues. It is an honor and a privilege to introduce my dear friend, Dr. Christopher Gribbin, whom I have known very well for the past, well over 25 years, working side by side as an interventional radiologist and a surgeon, a vascular surgeon. Born to Mr. Charles and Mrs. Justin Gribbin and raised in White Plains, New York, Chris graduated from Cornell Medical School and after experimenting a couple of specialties, ultimately settled into radiology with a subspecialty in interventional radiology. Upon completion of his training, he joined St. Peter's University Hospital family and has been there ever since. He's part of University Radiology Group, largest in the state of New Jersey. Thanks, right?
Yes.
A talented and an exceptional interventionalist, it has been a pleasure to have been associated with him. In fact, we have worked together crafting the prompt payment law, as well as founding the first multidisciplinary vascular institute at St. Peter's. Further details of his professional and organizational achievements are in the souvenir journal, so I will spare you. What I would like to do right now is to focus on a couple of his personal endeavors and achievements. Chris is surrounded by women, 3 of them to be precise. His mother, Justin, who's just 2 years shy of a century. His beautiful wife, Chris Dorota, a physiatrist, and his charming daughter, Caitlin, who is a 4th-year medical student at Cornell, following the footsteps and continuing the legacy of her parents' profession. Well, Dorota, I'm not sure if you know this secret. When I asked Chris as to when he first met you, or met his future bride, he narrated an incident. When he was at the Manhattan VA, he said that We both met in an elevator for the first time ever, and when I saw Dorota, I said to myself, I'm going to marry this woman. And when they stepped out of the elevator, Dorota seemed somewhat unfamiliar with the surroundings. So what does our Chris do? He steps out and says, "May I help you?" Those were his first words to Dorota. And he has been helping since. Rest is history. And this is really funny. Dorota remembers that on one of his many sightseeing dates, apparently they did a lot of sightseeing dates, on top of a New York skyscraper, he points to his hometown and says, "Well, that's where I grew up." Guess what? Subsequently, they got married in the same town. Another vivid and a charming incident that Dorota remembers is a road trip that they took in California, one of the sightseeing trips that they were taking. New at driving, she was behind an annoying driver on a narrow street and in a curvy highway, and Chris had fallen asleep. Dorota wanted to honk at the driver ahead, but did not know where the horn was. So she keeps asking Chris, says, "Where is klaxon? Where is klaxon?" Klaxon in Polish means horn. Our Chris, falling asleep, wakes up, pulls out the map, and starts looking for a klaxon. Well, Chris, it is time now. Blow your klaxon. Through MSNJ and the AMA, we stand behind you as you take on this baton. It is once again my pleasure, ladies and gentlemen, to present you our 225th President of the Medical Society of New Jersey, Dr. Christopher Gribbin.
Thank you, Dr. Rao. The speaker now recognizes Dr. Gribbin for his inaugural address.
Thank you, Madam Speaker. Dear colleagues, it's an honor to stand before the House of Delegates of the oldest medical society in America, the Medical Society of New Jersey, to assume its physician leadership for the coming year. I thank you for trusting me to take my place in the great tradition of leaders of MSNJ, the continuity of which is made evident by our key ceremony. Those who have come before me are truly those who have made our medical society what it is. They are inspirational leaders, they are great physicians, they are invaluable advisors. I thank every one of them for admitting me to this sacred trust. I also thank the tremendous staff of our society who help create policy, advocate, guide legislation and regulations, and run the society day by day. Without them, none of us would be here. I especially want to thank my wife, Dorota, who has been so supportive of me and understanding of the time this commitment entails. No Scots today. I approach this year with a deep sense of well-being and optimism. We have a great profession. Doctors are routinely held in high esteem by the public. According to a Gallup survey, more than 2/3 of the public rate the honesty and ethical standards of physician as very high or high. Medical school is now more competitive than ever to get into, and the medical school where I have a faculty appointment, Rutgers Robert Wood Johnson, had an admission rate of 4% last year. There are some medical schools who are even as low as 1.6%. Average admission MCAT scores and GPAs are such that I clearly would not be attending medical school if I was applying now. Despite quite legitimate rumblings to the contrary, physician satisfaction with their profession is astoundingly high. 90% of physicians stated that they were very or somewhat satisfied with their career choice, according to a recent AMA survey. This same survey found that 3/4 of doctors identified medicine as a calling, a sentiment that they identified by age 20. Negative factors included all that we've been talking about all day long and we're all very, very familiar with: administrative burden, stress, lack of time, long hours, on-call schedules. Despite these factors, career choice remained high, and this is no mystery. Our ability to cure diseases once thought incurable has increased tremendously in the past 10 years and grows by leaps and bounds daily. Many diseases that were once considered death sentences are transitioning towards chronic, difficult, but often manageable diseases. Average life expectancy has increased from 54 years in 1950 to 71 and a half in 2014. It continues to increase. Who wouldn't want to be at the forefront of this incredible advancement? Medicine is a truly fulfilling profession, and to be able to practice it is a real privilege. In addition to our feeling of being called to the profession and the empathy for our patients that comes with this, we bring with us the knowledge that all of our years of study has imparted to us through hard work and long hours. And we bring with us the skill, the ability to heal, skill that we learned through endless hours of residency and honed in our hours of practice. We are the medical scientists in our daily interactions with patients, where we bring our knowledge and empathy together to heal. We are patient advocates, and as such occupy a crucial place in the triad of payers, hospitals, and physicians caring for patients. As we go forward and create teams to deal with all the varied areas of healthcare delivery, it is important that these teams be led by physicians. As care teams evolve, mutual respect on the part of all participants is essential for their success. This foundation of knowledge, skill, empathy, and respect will be our guiding force, the light that illuminates our faces, the wind behind our sails, as we advocate for our patients and our profession. While doctors are professionally happy, they are often more than discouraged by a worsening daily grind of disenfranchisement, imposed duties that are essentially clerical, meaningless reporting of pseudo-quality metrics, pressure from payers and employers, punishing economic constraints, excessive work hours, many other factors that detract from the practice of medicine. We're frustrated by witnessing the transfer of healthcare funds from patient care and physicians to healthcare bureaucracy. One of our main jobs as physician advocates in the Medical Society of New Jersey is to work to remove those burdens as best we can, so we can all spend more time doing what we do best, which is delivering great care for our patients. Legislative advocacy, both in our state and nationally, is a core mission of the Medical Society of New Jersey. We've been active on both levels through our AMA delegation nationally and through our work in Trenton locally. Within New Jersey, we oppose any attempt to link maintenance of certification with medical licensure or hospital privileging. We continue to advocate for the repeal of the onerous ambulatory care facility tax, which unjustly punishes physicians' practices to provide funds for uncompensated care. We will continue to work with our coalition of hospitals and physician practices, confronting the challenge of legislation addressing out-of-network care delivered in an otherwise in-network setting, the outcome of which has vast ramifications for all physicians, perhaps especially including those who practice mainly or entirely in-network. We have advocated for mutual transparency and network adequacy as an alternative to the prescriptive proposals we've seen in this legislation. We advocate for the elimination of burdensome, uncompensated pre-authorization requirements and to eliminate pre-authorization as no guarantee of payment from the payer lexicon. If a physician is judged to be of sufficient quality that he or she is admitted to a network, surely that same physician is competent enough to order a test, a procedure, or a medication without being second-guessed by someone who is not a physician and is not involved in the care of that patient. On the national level, through our well-respected AMA delegation, we support legislation aimed at reforming the medical malpractice system, including a cap on non-economic damages in medical malpractice cases. Another aspect of liability reform supported by the AMA and recently decided favorably was a prohibition on state shopping for venues to bring medical malpractice cases. We have also advocated for relief from burdensome reporting requirements which impair our ability to spend time with our patients and deliver best care. And who doesn't think that's about EHRs? It is. We are engaged with our congressional representatives as they attempt to frame new healthcare legislation. The first step has been taken now with the House passage of the American Health Care Act. In our advocacy, your New Jersey delegation stressed that modifications should not result in loss of coverage for those who have it now, including those who received it through Medicaid expansion. The opioid epidemic is a crisis that calls for both state and national efforts. Reducing opioid use for pain management requires increasing access to non-narcotic pain management. This includes eliminating burdensome pre-authorization and treatment plan oversight, which stand in the way of attempts to decrease reliance on opioid pain relievers. Access to addiction treatment services needs to be improved. And as we confront this crisis, it is important not to be overly prescriptive towards physicians, as similar attempts to emphasize rapid treatment of pain as the fifth vital sign and reliance upon satisfaction surveys that rewarded increased dispensation of opioids helped fuel this epidemic in the first place. The crisis and the cost of prescription medication is one which has rapidly escalated over the past few years. We now have a situation where the cost cannot be justified as reimbursement for research and development or a reward for the risk of trying to bring a medicine to market where the outcome is uncertain. Instead, we face hedge fund purchases of single or small drug manufacturers and subsequent massive increases in price for profit only. Where's Ralph? Ralph, this is for you. We advocate for free and fair markets. Legislative advocacy is just part of our program at MSNJ. We are active in the legal area, where our amicus briefs have been instrumental in several court decisions. We accredit CMA programs all around the state. We are collaborating with payers and hospitals to build a leadership academy to solve pressing healthcare issues facing New Jersey. This academy exists now, is in session, and the first issue being tackled by this group is end-of-life care in New Jersey. As we move towards population health-based approaches to care, MSNJ is focused upon supporting physician leadership. In the next year, you will see MSNJ launch an initiative to create interoperability among disparate EMR systems, so physicians will have better clinical information about their patients. These programs bring the physician's voice to improving quality and lowering costs in healthcare. As we move forward to have a strong voice, it is certain that we will need two things: members and money. We seek to include all physicians, from solo practitioners like my wife Dorota to members of large groups like myself. We have a great and strong system of county medical societies in New Jersey who form the backbone of our state societies. And while you may get seasick doing this, I would like to ask for the presidents and executives of all county medical societies in attendance to please stand and be recognized. Our future is dependent upon our medical students, and for the third time, I'd like to ask our medical students present to stand and be recognized. You know what? It's worth the third time. We have successfully reached out to large groups over the past year and brought many into the medical society. In the coming year, we hope to reach out to even larger groups, including employed physicians, hospital-owned practices, hospital-affiliated practices. Ultimately, we all have the same goal in mind: delivering the promises of modern medicine to our patients as safely, effectively, and efficiently as we can. So in closing, I'd like to say this is going to be a great year. A year of hard work, engagement, advocacy, creativity, camaraderie, and strength, with the foundation of knowledge, skill, empathy, and respect. We're well prepared to meet the challenges ahead. Thank you very much.